shifting gears into the white blood cells or the leukocytes. Now, these leukocytes, they make up less than 1% of all the formed elements, but yet they are extremely important in many different avenues. So one of the interesting features, though, is they can leave the bloodstream. They can leave the capillaries. It's called diapedesis, or also known as emigration. What happens is the cells, these white blood cells, are going to squeeze between the cells of the capillary, getting into the surrounding tissues around that capillary. Well, why? They're doing this via an amoeboid action to follow positive chemotaxis. Basically, what that means is they picked up some chemical trail and they're trying to follow it. The amoeboid action is they're simply a cell. They're kind of squishing through different areas and spaces. They're trying to find the source of this chemical signature. There's positive chemotaxis. Kind of think of it as a bloodhound following a scent. But this is white blood cells following a chemical trail. Leukocytosis is one of the reasons they can do this, because leukocytosis is when they have a count over 11,000 cells per cubic millimeter. I'm saying, what's a cubic millimeter? You take your fingers and put them together, that little tiny triangle is a cubic millimeter. So you have about 11,000 cells in that. That means you have more than normal. Typically means you're having an infection. Viral or bacterial infections will increase your white blood cell count because you're trying to fight them off. So therefore, these cells then will try to find those infections. The way they try to find them, and I'll throw this up full screen here, is initially you have the cells inside of the capillary, but there's a damage, something happened, a cut, infection. Those cells are going to squeeze out through again. This is going to be that simple removal. They're trying to follow a chemical trail. This is going to be looking at positive chemotaxis. It's trying to say, hey, here's a signal. We want to get out to that signal. So this is now leaving it, this emigration. Once they're out there, the cells themselves have different actions. For example, we have one here that is going to be an eosinophil. I'll talk more about that later, secreting these chemicals. We have one here, the monocyte, that became a macrophage, eating and destroying things. Other one's a neutrophil at the bottom there. Each white blood cell has its own important role, but they can, again, follow the chemotaxis, follow these chemical trails, and leave the bloodstream. So you kind of squeeze out and get out there to follow the chemical trail. All right, so back to the whole picture of all 5 of the white blood cells. Now, all 5 are less than 1% of your blood. But in that 1%, you're going to have your neutrophils as the most common. Give or take about 50 to 70% is neutrophil. Now, do you need to memorize those numbers? No. But you do need to know that neutrophil is the most common of the white blood cells. You need to know that basophils are the rarest of the white blood cells. So you kind of want to know the rough order, which is the most common, second most common, mid-range, second from the bottom, and the bottom one. However you want to remember that, go for it. This might be a stupid mnemonic, but if it works, great. Never let monkeys eat bananas. All right, whatever. But N is neutrophil, L is lymphocyte, M is monocyte, E is eosinophil, B is basophil. It tells you the most common to the least common of the white blood cells. Now, as you're going through here, again, don't worry about the percentages, but know most common to least common. All right, we'll start off with the granulocytes. All 5 of the white blood cells are split into 2 categories, granulocytes or agranulocytes. In the case of the granulocytes, these 3 white blood cells will show granules in their cytoplasm. The 2 agranulocytes, we'll get to later, they will not show granules in their cytoplasm. Now, these granules are visible because of the Wright's stain. So all these granules are stained with this Wright stain. So if you look under the microscope without a stain, you're not going to see these granules. But the staining makes them more visible, makes it easier to identify and see what's going on. So we have three different ones. We have the neutrophil, which takes up both acidic and basic dyes, which basically means it's neutral. We're then going to have the eosinophil, acidic, and then the basophil, basic. So they're taking up these stains, and therefore the granules are visible. All three of these are phagocytotic, which means they can eat and destroy in certain cases. All right, let's go one by one. Let's start with the neutrophil. The neutrophil itself, which is this cell right in here, the neutrophil itself, it takes up both the acidic and basic dyes I mentioned, but the way to identify it, besides the granules, you'll have 3 to 6 lobes. Now, this particular one here has 4 lobes. It might look like there's 4 different dots, but if you look very carefully, you'll notice that each one has a very thin line connected. So if you're looking at under a microscopic view, you'll notice that all the granules are scattered around, the lobes are in the center, and they should have a connection to them. 3 to 6 lobes. That's the neutrophil. Now, these neutrophils, can think of them as the body's bacteria slayers. Because while other white blood cells can also kill bacteria, neutrophils are usually first on the scene. They're usually doing the highest percentage, so they're really destroying a vast majority of bacteria. They're roughly 50 to 70% of your white blood cell counts. So at any given time, you take a count, these ones are there. Now, if they're in a higher percentage, maybe they're at 80% or 90%, this higher than normal count means you've had a recent bacterial infection. Because if you have a bacterial infection, these cells are the first ones to respond. So their count goes higher compared to the other 4 types. So a recent infection, a recent bacterial infection, is indicative of a neutrophil having a high count. So just to look at what we're seeing here, this is your neutrophil. And again, I'm going to blow this up full screen, get a little better view. The neutrophil is right in the middle here. You'll notice it's a little bit bigger than the rest of the red blood cells, but notice the 4 distinct lobes. Each one of these, 1, 2, 3, 4, is a lobe. And all 4 of those are going to be connected with a very thin filament, so it's all just one nucleus. So that is the neutrophil. Next up is eosinophil. Now, the eosinophil isn't the rarest, but it's down there. It's only 1 to 4%. What you typically have here is the granules are stained, and you have a bilobe. So 2 lobes in the nucleus. So again, neutrophil was 3 to 6. This eosinophil is 2 lobes. Now, the eosinophils have 2 main functions. The one function is fighting parasitic worms. I really hope you don't have to worry about that. But if the case there, these are what they do. They fight off parasitic worms. Second functionality is dealing with helping to lessen the severity of allergies. What they're doing is these eosinophils will phagocytize the different allergens. They'll try to break them down. So it's trying to lessen the effect they have on your body. This is the eosinophil. Now again, blow this up full screen. What you're seeing here is the eosinophil. Now if you look carefully, you'll notice there is 1 lobe and a second lobe. So again, eosinophil are bilobed. So that's the eosinophil. Also, notice the granules. A little bit darker staining. So it's not quite as easy seeing the actual nucleus compared to the neutrophil. So that's your eosinophil. And the third in this category of these granulocytes is the basophil. Basophil is the rarest, about 0.5%. These ones, if you're scanning through a slide, it takes a little bit of time to find one. They typically have a U or S-shaped nucleus. Now, if you're looking and saying, I can't even see that, that's typical. the basophil granules stain very dark and it makes it very hard to see the actual nucleus. But notice these granules make for a bumpy edge. So the granules themselves kind of protrude off the edge. So it's not a nice smooth cell surface. You got bumps out there. Now all these granules are containing histamine. Now that's histamine, not antihistamine. Histamine. Histamine is what causes your allergies a lot of times, can cause inflammations. So this is important because these basophils will release these histamines at sites of injury, when you just swell, at sites of infection, when you're trying to contain things. These histamines can cause that inflammatory response. And that's why when you have sometimes allergies, you take antihistamines to try and reduce all of these. But the basophil produces histamines. So again, blowing this up full screen, what you're seeing in the basophil is the U or S-shaped nucleus, which you really can't see very easily. But notice again, the actual ends are kind of bumpy. Those granules do not allow for a smooth cell membrane surface. So that is the basophil cell. So those are your three different granulocyte cells, your neutrophil, your basophil, and your eosinophil. So all three of those are granulocytes. That's the category. So each cell is in the category of granulocytes.